Blackheads are one of the most common skin concerns I see in clinic, and they can be frustrating because they often come back even after you feel like you've cleaned your pores. The good news is that blackheads are very preventable when you understand what they are, what triggers them, and how to build a routine that keeps pores clear without irritating your skin. Everything I'm sharing here is general education and not a personal medical diagnosis. If you have severe acne, painful cysts, scarring, or a rash that won't settle, it's best to consult a qualified dermatologist for individualized care. For most people, though, blackhead prevention is about gentle consistency and a few evidence-based steps that you can do safely at home. To prevent blackheads, you first need to know what causes them. A blackhead is an open come done, which means a pore becomes plugged with a mixture of sebum, your skin's natural oil, and dead skin cells, and the top of that plug is exposed to air. The dark color is not dirt. It's mainly oxidation of the material in the pore and sometimes the way light reflects off the pore opening. This is important because it changes the way you should treat blackheads. If you assume they are dirt, you may scrub aggressively, use harsh cleansers, or overwash your face. Those strategies often backfire because they irritate the skin barrier, make the pore lining swell, and can actually trap more debris inside the pore. Prevention is not about harshness. It's about keeping the pore lining shedding normally, keeping oil moving out of the pore, and protecting the skin barrier so it stays calm and resilient. Blackheads form more easily in certain zones, especially the nose, central cheeks, chin, and forehead, because these areas have a high density of oil glands. Genetics play a role, hormones play a role, and lifestyle and product choices can strongly influence how clogged pores become. If you're in your teens or early 20s, it's common to have more oil and more blackheads. Hormonal shifts during menstrual cycles, stress, sleep changes, or certain medications can increase oil production too. In warm, humid climates, sweat and oil mix more easily and can contribute to congestion, especially if sunscreen and makeup aren't removed thoroughly. Friction and occlusion, things like masks, helmets, tight collars, chin straps, and even resting your hand on your chin, can trap heat and oil and encourage blackheads in those contact areas. One of the most common reasons people keep getting blackheads is that their routine is missing one critical ingredient category, a true pore clearing active. Cleansing alone can remove surface oil and product residue, but it usually does not change the internal behavior of the pore. Blackhead prevention requires at least one ingredient that helps prevent the plug from forming in the first place. The two most proven options are salicylic acid, also called beta-hydroxy acid or BHA, and topical retinoids, which include over-the-counter retinol or prescription-strength options through a clinician. Salicylic acid is oil-soluble, which helps it travel into the pore and loosen the mix of oil and dead cells. Retinoids normalize the way skin cells shed inside the pore, reducing the sticky buildup that forms comedones. These ingredients work best when used consistently and gently over time, not when used aggressively for a few days and then abandoned. Before you add actives, you need the right foundation, cleansing, moisturizing, and sun protection. This foundation keeps your skin stable so it can tolerate the ingredients that prevent blackheads. Think of it this way, a damaged barrier makes everything harder. If your face feels tight, stings when you apply products, or gets red and flaky, you're more likely to quit your routine or overcorrect with harsh products. The goal is a routine you can maintain for months, because blackhead prevention is a long game. Let's start with cleansing, because it sets the stage for everything else. A good cleanser for blackhead-prone skin is gentle, low irritant, and effective at removing sunscreen, oil, and makeup residue. Squeaky clean is not the goal. That squeaky feeling often means your natural barrier lipids were stripped, which can lead to irritation and more oil rebound. For most people, cleansing twice daily works well, once in the morning and once at night. If your skin is very dry or sensitive, you may do better with a simple water rinse in the morning and a full cleanse at night. If you sweat heavily, especially after exercise, a gentle cleanse afterward helps prevent sweat and oil from sitting on the skin and mixing with debris. When you cleanse, use lukewarm water, not hot water. Hot water increases irritation and can worsen redness. Use your fingertips, not rough scrubbing tools. Massage the cleanser for about 20 seconds, paying attention to areas where pores clog, then rinse thoroughly. Pat dry with a clean towel. Rubbing aggressively can cause microirritation, and irritated skin is more likely to clog and break out. At night, cleansing is particularly important because you need to remove sunscreen and any makeup or environmental residue. If you use water-resistant sunscreen or long-wear makeup, consider a gentle double cleanse. That can mean first using a mild cleansing balm, cleansing oil, or micellar type remover to break down product, then following with your regular cleanser to remove residue. The goal is not to overwash. The goal is to remove pore clogging residue thoroughly without stripping the skin. Once cleansing is in place, moisturization is the next step that many blackhead-prone people misunderstand. It's common to skip moisturizer because you fear it will clog pores. But dehydrated skin can become rougher and more prone to plugging because the surface shedding becomes uneven and the barrier becomes compromised. Also, when your skin is overly dry from harsh cleansers or actives, it may respond by producing more oil. A lightweight, non-comedogenic moisturizer helps keep the barrier balanced, reduces irritation from treatments, and makes your routine more sustainable. Look for moisturizers that feel light and absorb well. Ingredients like glycerin, hyaluronic acid, and ceramides can support hydration and barrier function without feeling heavy. The exact product matters less than consistent use and how your skin responds. Sun protection is not just about preventing sunburn. Ultraviolet exposure contributes to thickening of the outer skin layer over time, which can make pores appear more obvious and can worsen congestion. Sunscreen also protects your skin while you're using acne-preventing actives, which can increase sun sensitivity. If you're trying to prevent blackheads, you want a sunscreen you can wear every day. Many people do well with lightweight gel or fluid sunscreens labeled non-comedogenic. If a sunscreen feels heavy or seems to worsen congestion, don't assume you must quit sunscreen. Instead, try a different texture. Daily sunscreen is a long-term investment in clearer texture and more even skin. Now let's move to the core prevention ingredients, salicylic acid and retinoids. You do not have to use both to see improvement, especially at the beginning. In fact, starting with both at full intensity is a common reason people get irritated and stop. Choose one core active first, build tolerance, and then decide whether you need to add more. Salicylic acid is often the most direct choice for blackheads because it can travel into oily pores. It helps loosen the buildup inside the pore and can reduce the formation of new plugs. It comes in cleansers, toners, serums, and pads. For prevention, a leave-on salicylic acid product used a few times per week can be very effective. A salicylic acid cleanser can help too, but leave-on products tend to work better because they stay on the skin longer. The key is to start slowly. If you've never used salicylic acid, begin with 2 or 3 nights per week. Apply a thin layer to the areas where you get blackheads. Let it absorb, then follow with moisturizer. If your skin remains comfortable after a couple of weeks, you can increase frequency. If you notice dryness or mild flaking, that can be normal early on, but if you get burning, significant redness, or peeling that persists, reduce frequency and focus on moisturizing until your skin calms down. Retinoids are one of the most powerful long-term prevention tools because they change the behavior of the pore lining. Blackheads form when the lining of the follicle becomes sticky and doesn't shed properly, allowing dead cells to mix with oil and create a plug. Retinoids help normalize that shedding. They also improve texture over time and can help pores appear less noticeable because they stay clearer. The downside is that retinoids can be irritating if started too fast. If you choose a retinoid approach, start with a very small amount and a gentle schedule. Use a pea-sized amount for the entire face. Dot it across the forehead, cheeks, nose area, and chin, then spread a thin layer. Do not spot apply a thick layer on the nose, because that often causes irritation without improving results. Begin 2 nights per week for 2 weeks. If your skin tolerates it, move to every other night. Only consider nightly use after several weeks if you are not getting significant irritation. Moisturizer is your partner here. Many people do best with the moisturizer sandwich method in the beginning. Apply moisturizer, then the retinoid, then another thin layer of moisturizer. This can reduce irritation while still giving you long-term benefit. If you're wondering which active to choose, here's a simple way to think about it. If your main issue is visible blackheads and oily pores, salicylic acid often gives you more direct early improvement. If your goals include long-term prevention, smoother texture, and fewer recurring clogs across the face, a retinoid is a strong option. Many people eventually use both by alternating nights, but you do not need to rush. Your skin's tolerance is more important than doing everything. One of the most important principles for blackhead prevention is avoiding irritation. Irritation can cause the pore opening to swell slightly, which makes it harder for oil and debris to exit. It also weakens the barrier, leading to sensitivity and a cycle of overcorrecting with harsh products. This is why I emphasize gentle steps and gradual changes. If you're using a pore-clearing active and you feel stinging every day, you're not pushing through. You're likely damaging your barrier, and your blackheads may actually persist or worsen. Let's talk about exfoliation, because it is commonly misunderstood. People often think they need to scrub blackheads out. Physical scrubs can temporarily make skin feel smooth, but they can also create tiny irritation that leads to more congestion over time. If you want exfoliation, chemical exfoliation is usually safer and more targeted, especially salicylic acid for blackheads. Alpha hydroxy acids like glycolic acid or lactic acid work more on the surface and can help with dullness and texture, but they are not as pore-targeted for blackheads as BHA. If you add an AHA, use it occasionally and not on the same night as a retinoid in the beginning. Too many exfoliants at once is one of the fastest ways to trigger irritation and breakouts. Now let's build a practical routine in a way that is easy to follow. In the morning, you want to remove overnight oil and prepare the skin for the day. A gentle cleanse is usually enough, followed by a lightweight moisturizer if you need it, and then sunscreen. In the evening, you want to remove sunscreen and products thoroughly, then apply your treatment, then moisturize. The details can vary based on your skin type, but the structure stays the same. If you keep the structure consistent, your pores will gradually stay clearer. If your skin is oily, you may prefer a gel cleanser and a very lightweight moisturizer. If your skin is combination, you might moisturize mostly the cheeks and use less on the T-zone. If your skin is dry or sensitive, you may use a cream cleanser and a richer moisturizer, while still using a gentle active less frequently. The routine should fit your skin, not punish it. A major contributor to blackheads that many people miss is product occlusion. Non-comedogenic on a label can be helpful, but it's not perfect. What matters is how your skin responds. Heavy creams, thick balms, greasy sunscreens, and certain makeup primers can increase congestion in some people. If you notice your blackheads worsen after adding a new product, remove it for 2 weeks and observe. Don't change 5 products at once. Change one thing at a time, because troubleshooting is part of prevention. Hair products are another hidden trigger, especially for forehead and temple blackheads. Pomades, heavy oils, and leave-in conditioners can transfer to the skin along the hairline. If you get blackheads on the forehead, use hair products carefully, keep them away from the scalp edges, and cleanse the hairline thoroughly at night. Washing pillowcases regularly can help too, especially if you use hair styling products. Let's address picking and squeezing, because it's one of the most common reasons blackheads turn into inflamed acne. When you squeeze a pore, you can push material deeper and rupture the follicle wall. This can trigger inflammation, prolonged redness, and sometimes scarring. Even if you get something out, the trauma can cause the pore to swell and clog again. If you're tempted to squeeze, it usually means you want faster results than your routine is giving you. The solution is not more squeezing. The solution is steady prevention plus patience. If you have stubborn blackheads that do not respond after consistent care, professional extraction in a clinical setting is safer than doing it yourself at home. There's also an important concept that helps reduce frustration. Not every dot on the nose is a blackhead. Many people have sebaceous filaments, which are normal structures inside pores that help move oil to the surface. They can look like tiny gray or dark dots, especially on the nose and inner cheeks, and they refill quickly after you clear them because they are part of normal skin anatomy. Prevention routines can make them less noticeable by keeping pores cleaner, but they may not disappear entirely. Understanding this helps you avoid overtreating and damaging your skin in a cycle of trying to erase something that is partly normal. If you wear makeup, you can still prevent blackheads. The key is removal and product selection. Heavy foundations and thick primers can contribute to congestion, but you don't need to avoid makeup altogether. Make sure you remove it thoroughly at night, especially around the nose and chin where makeup can settle into pores. Clean your brushes and sponges regularly because they collect oils and residue. Avoid sleeping in makeup. Even one night can increase congestion and set your progress back. If you experience blackheads around the jawline, chin, or mouth area, consider friction and occlusion triggers. Masks, frequent face touching, phones pressed against the cheek, and shaving irritation can all contribute. If you shave, use a gentle shaving product, shave with minimal pressure, and moisturize afterward to reduce microirritation. If you wear masks for long hours, cleanse after extended mask wear, use a light moisturizer to reduce friction, and avoid heavy occlusive products under the mask. Change masks regularly. A humid, friction-filled environment can trap oil and debris in pores, and small adjustments can make a big difference. Lifestyle influences blackheads indirectly through oil production and inflammation. Sleep and stress are not cosmetic details. They affect hormones like cortisol that can increase oil production in some people. Aim for consistent sleep, and if stress is high, consider simple management techniques like regular walking, breathing practices, or structured routines. Exercise is excellent for skin health and circulation, but sweat left on the skin can mix with oil and contribute to congestion. Rinse and cleanse after workouts. Diet is a topic people often want clear rules about, but the reality is individual. Some people notice acne is worse with high glycemic diets, lots of sugary snacks and refined carbohydrates, because of how those foods can influence insulin and related pathways. Some people notice flares with certain dairy intake. These patterns are not universal, and you do not need to eliminate entire food groups unless you observe a consistent connection. A balanced diet emphasizing fiber-rich foods, lean proteins, healthy fats, and plenty of colorful plants supports overall skin resilience. If you want to test a dietary factor, change one thing at a time for several weeks and observe. The goal is not perfection, the goal is understanding your skin's patterns. Now let's discuss the quick fix products that can be tempting. Pore strips can pull out surface material and look satisfying, but they don't change the way blackheads form and they can irritate the pore opening. Clay masks can temporarily reduce surface oil and make pores look smaller, but they should be occasional, not daily. If you like clay masks, treat them as a supportive once-weekly step, followed by moisturizer. Do not rely on them as your primary prevention tool. The foundation of prevention remains consistent cleansing, a proven